Hey, Dr. H here. Another episode of Physio on the Go. Going for a hike with my daughter Natanya. You say hi?
Hi.
So, we're hiking up a local trail near our house. Having a little bit of a rest day. I did a 15-mile run yesterday. We can't see where, up a mountain near our house. So, anyway, today I thought maybe we would talk about heart sounds and how they relate to what the heart is doing as part of your cardiac cycle. So, put this guy back on here. So, we've all heard heart sounds. Maybe you've listened to them or heard a recording of them or something where it goes lub dub, lub dub, lub dub. Okay, so two normal heart sounds. Okay, so lub dub, pause, lub dub, pause, lub dub, pause, lub dub, pause. Okay, that is the normal sound you hear when you listen to somebody's heart. Okay, so what causes that? Well, in order to understand what causes that, we need to understand a couple of things about the heart. One, we need to understand why do we have these things called heart valves. Okay, so we have two sets of valves in our heart. Okay, now we'll do an anatomy of the heart some other time, but the heart is divided into right sides and left sides, and on each of those sides there are two chambers, one on the top called the atria, one on the bottom called the ventricles. Okay, the atria receive blood coming into the heart, so they're receiving chambers. Then the blood goes down into the ventricle. The ventricle is a pumping chamber. It squeezes the blood out to the body or to the lungs. Okay, there's a pulmonary circulation and a systemic circulation. But to understand the heart sounds, we need to understand blood coming into the heart has to come into the atria, then go down into the ventricle, and then be pumped out through a blood vessel. If it's going to the body, it goes through a vessel called the aorta. If it goes to the lungs, it goes through the pulmonary trunk and then pulmonary arteries. Okay, so in order to understand heart sounds, lub dub, lub dub, lub dub, we need to think about valves involved in this. Okay, so between the atria and the ventricle there is a valve. Okay, like my thumb here. Okay, can open, can close. Okay, so blood can come from the atria down into the ventricles when it's open and not when it's closed. Okay, so that first valve we're going to call the atrioventricular valve because it's between the atria and the ventricle. Okay, and it opens like this and closes like this. Opens like this, closes like this. Okay, now when we think about heart valves, we first need to ask the question, what's the point? Why do we have heart valves? Okay, well, here's the atria, here's the ventricle. We fill up the ventricle, and when the ventricle contracts, we didn't close the valve back into the atria, we would just pump the blood back into the atria, which would be counterproductive. That it would be regurgitation. Okay, so we need a valve okay, between the atria and the ventricles, so that when the ventricle contracts, the valve stays closed, the blood can't go backwards, so it goes forwards into the aorta, okay? So we need this valve, the atrioventricular valve, because when the ventricle contracts, we can't have the blood going backwards. Now we need an opening, of course, because if there was no opening, we could never fill up the ventricle, right? So we need to be able to open the valve and fill the ventricle, and then close the valve when we're trying to empty the ventricle, okay? So we're filling the ventricle, pumping it out. Filling the ventricle, pumping it out, okay? So what is the purpose of the atrioventricular valve? To make sure blood does not go backwards from the ventricle into the atria, okay? And then we need to remember the ventricle has two phases. Systole, when it's contracting, and diastole, when it's opening or relaxing. So systole, diastole, systole, diastole, okay? Now, what we need out of this valve is we need it to close during systole and open during diastole. Close, systole, open, diastole. Close, systole, open, diastole, okay? So that's what happens. This valve is opening when the ventricle is relaxed and closing when the ventricle is contracted, okay? So the way that works is it's shaped kind of like this, okay? So when the ventricle is relaxed, blood has been coming into the atria all this time, and the pressure is building up a little bit in there behind this closed valve. Okay, when the ventricle relaxes, this is going to open. What causes this to open? The pressure in the atria is higher than the pressure in the ventricle. Yes? So when the pressure is higher up here, this valve opens. When does that happen? When the ventricle is in diastole, it's relaxing. The pressure is really low, okay? So that causes it to open. So how do we open this valve? We are in diastole with the ventricle. It opens, and then we fill the ventricle. That makes sense, okay? How do we close the valve? Well, when it's open like this, when the ventricle contracts, it raises the pressure and pushes the flaps up, okay? And then we close that valve. So we're in diastole, it's open, and systole, it closes. So open in diastole, closed in systole, okay? So the valve is like any other door. You hear it when it closes. You really, unless we have a creaky valve, which is possible, you don't hear it opening. You do hear it slamming shut, boom, okay? So, the first heart sound, lub-dub, lub-dub. The lub is when we go into systole and we slam that first valve shut. Okay, so we're in diastole and then we slam it shut, slam it shut, slam it shut. That is the first heart sound. Lub, 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 lub. Okay? So sounds number one is what? Closing the AV valve, atrioventricular valve, when the beginning of systole. Okay? So, great. What have we accomplished? We pumped blood out of the ventricle into a blood vessel. If it's the left ventricle, it's the aorta, okay? So then, we're going to go back into diastole. This valve is going to open again, but that doesn't make a sound. Okay? So where do we get the second sound? Well, there's also a valve in the aorta leaving the ventricle. Okay? So if here's the ventricle, the aorta leaving has a valve. Okay? So, which is just the opposite. It's like this. The AV valve was like this, the aortic valve is like this. So when the ventricle squeezes, it pushes it open because the pressure is higher in the ventricle than the aorta. So the ventricle squeezes, opens that. The beginning of systole. Okay? Right around the same time that this valve, AV valve, was closing. This happens first, and then this opens. Okay? What is the point? So we can get the blood out into the aorta. Okay? Now, that still didn't cause a sound, usually, because when a valve opens, we don't hear it. We hear it closing. So when does the aortic valve close? Well, when the ventricle relaxes, the AV valve opens, but the aortic valve closes. Why? So that the blood we just pumped out doesn't come right back in. Boom. Okay? So with the aortic valve, systole, it's open, blood's coming out. Diastole, boom, closes, blood doesn't come back. Systole, diastole. Systole, diastole. So, the second heart sound is caused when this valve slams shut. Boom. Okay? So, that is S2. Boom. When does that happen? At the end of systole and the beginning of diastole is when that happens. So 2 heart sounds, lub and dub. Check out the view for a second. Lub, when does that happen? When we slam the AV valve shut, beginning of systole. Dub, when does that happen? When we slam the aortic valve shut at the end of systole, beginning of diastole. So, lub, dub. Lub, dub. Okay? So those are the 2 heart sounds that you usually hear when you're listening to someone's heart. I hope that was helpful. Check out the view. We're gonna run back home. All right, take care. God bless.
Thanks for watching Physiology Fundamentals with Dr. H. Please like and subscribe. And don't forget to get outside and go for a run.